The American Association of Orthodontists recommends that every child by age 7 to 8 years old should have a consultation with an orthodontist. The reason for this is to see if there's anything going in the wrong direction or any hidden surprises that we may not know about. So with the younger kids, we look for a few certain things. I have about 6 or 7 triggers in my mind that are things that will need early correction. An example of this would be a crossbite. If our permanent molars in the way back come in and fit together in the opposite orientation, then that needs to be fixed. A crossbite can limit our normal growth of our jaws, and so we need to alleviate that and allow the child to continue to grow normally. Another example would be if they suck on their thumb. That can cause our incisors, our front teeth, to stick out too far and limit our ability to chew and bite into things. And so that is something that we can definitely address. Another example would be if we have teeth underneath that are going in a bad direction, that may be crossing over the tooth next to them. There are steps that we can take to alleviate this and prevent things from being much more difficult later on. No, all kids do not need treatment at a young age. In fact, we love to be as conservative as possible and wait until all of their permanent teeth come in. We have a lot of patients that we're seeing once or twice a year until all of their permanent molars and incisors and everything erupt into their mouth, and then we can be very efficient and do their treatment all at once and not have 2 separate phases. An average time for braces for a girl is usually between 11 and 12 years old. For a boy, they're more like 13, sometimes 14 years old. Boys' maturation is a little bit delayed when compared to girls. They usually enter puberty a couple of years later, and their teeth usually finish coming in a couple of years later. So again, we guide you along very well and we'll advise you when the time is right, but we want to make sure that all the teeth are in so that we can keep our patients in braces as short a time as possible.